name's Sarah. I'm a nurse and I work as an advanced clinical practitioner. I work in a prison environment. So how I have been using clean language is thinking about using it more in my consultations with patients. Often I think as clinicians we can put words into people's mouths when we're trying to do an assessment, and we've got a list in our head of things we need to go through in order to determine what happens next with that person. One example of me using it would be when a patient comes along with a pain issue. So instead of saying to them, describe, is the pain sharp, is it dull? I would say, okay, so tell me what type of pain is that pain? And then really listen to the words they're using, and then picking up on those words to say, okay, so tell me more about that. So you've mentioned this particular word, tell me more about that. What does that mean to you? And that's how I've been applying it in my consultations with patients.
And what difference does it make?
So for me, I think it really makes a difference to really take the time that person, I think, feels listened to and heard. And I feel that they actually give me a lot more information about what's going on for them in their situation. So I get more detail from the patient.
And when you get more detail and more information and they feel heard, what lets you know that they feel heard?
Because of how they are, I think sometimes they may come into a consultation with a preconceived idea of how they're going to be interacted with. And then I think when you start asking those questions, I can just see their engagement sort of change. They seem a bit calmer, a bit more positive about the engagement, and it feels like we're having a sort of a good conversation.
And you said it's a prison environment.
Mm-hmm.
That must introduce all sorts of interesting tensions and conflicts and different things. But my imagination is that prisoners would be quite surprised to be listened to.
Yeah, I think sometimes sometimes I think prisoners can have that expectation that they're not going to be listened to because they're a prisoner. I think people will judge them because of that. And actually, it is really nice at the end of a consultation when somebody gets up and they do say, "Oh, thank you for listening to me." That is actually really nice. And even if the outcome may be not what they would like, because sometimes they might be looking for medication that may not be clinically indicated and may not be safe for them to have. But because they've been listened to and had that opportunity to explain how it is for them, then they are grateful for that and for being heard. So that's really, when someone says thank you, I know that it's genuine, that they really do appreciate being listened to.
Another hallucination I have about prison environment is perhaps prisoners might not be particularly good talkers. They might not be particularly fluent with language and so on. People don't, in your experience, struggle to answer the questions there.
Not in my experience of using it. So yeah, some people, as you say, will have different levels of language abilities and different ways of expressing themselves. And but I think even to start with, even when people come in and you can sense that they are maybe reluctant to talk or giving short answers, when you start asking those questions, I find that they just naturally open up because the questions themselves allow that, really. And often I will pause and use silence if, you know, to a point as well, so that they have that thinking time. Because I think sometimes as clinicians there can be a tendency, okay, well, let's move on to the next thing, or let's ask the next question on my, you know, my little checklist I've got in my head of what I need to go through to assess this patient. I think, you know, giving that pause, often then they will fill that gap with something.